My name is Dr. Richard Dienza, and I'm a resident of the Internal Medicine Service here at the Schwartzman Animal Medical Center. It is my absolute pleasure today to introduce one of our favorite patients on service, Tammi Terrell. Tammi Terrell is an 8-year-old female spayed, wire-haired fox terrier who has a history of prior immune disease that has been treated by the head of our Internal Medicine Service, Dr. Douglas Palma.
She had been doing fine. She had been off of all of her drugs. She was doing quite well when she presented to the hospital again in January of this year.
She was immediately admitted into the hospital for emergent red blood cell transfusion, but she was incompatible to almost every single blood product here in the hospital. Out of necessity and lack of compatible blood, she was given an incompatible blood transfusion and started on immune suppressive medications, both of which are required to dampen the body's exuberant immune response.
We sent her blood to a national blood bank to have her blood analyzed against hundreds of donors with the hope that we could find a compatible cross-match and have it shipped back to us for a blood transfusion. And she was incompatible as well to all of those donors. At that point in time, we felt that she might have a rare blood type. We knew of one dog, Ming Ming, who had been previously diagnosed with this unusual blood type. Ming Ming happens to be one of our living legends here today. We reached out to Ming Ming's owner to see if she would be kind enough to bring Ming Ming to the hospital to see whether or not her blood was compatible with Tammi Terrell's blood. After mixing the two together in a test tube, we were able to determine that Tammi Terrell had the unusual blood type called Dal negative blood. Ming Ming's owner was gracious enough to allow Ming Ming to donate blood to Tammi Terrell. Unfortunately, this would only get us through the immediate crisis. Tammi Terrell needed more blood, and because of Ming Ming's size, she was only capable of donating a small volume of blood. With no options available and limited time, and Tammi destroying her red blood cells, we decided that we needed to do something urgent.
It has been described that removal of the spleen is successful in dampening immune responses for multiple different immune conditions. And for Tammi Terrell, this was the next step in her treatment.
She was a very unstable surgical candidate. So with the help of our talented surgeons and our amazing anesthesia staff, we were able to get her into surgery and out of surgery in a total 11 minutes. That's no easy task, to go to surgery and remove a spleen in 11 minutes. But time was of the essence. Going into surgery, Tammi Terrell had a red blood cell count of 6. 6 is as low of a red blood cell count as I've ever seen. 6 is a red blood cell count that normally gets you an immediate blood transfusion in any emergency room in the world. And we were able to get her in and out of surgery safely in 11 minutes. And that's a testament to our doctors. After the surgery, we unfortunately had to give her more incompatible blood, and she recovered. And those red blood cells were able to provide her some support for some time, but she still was in need. And so now it was time. Now we were waiting to see whether or not removing her spleen would stop this attack of her red blood cells and platelets. And we waited. And fortunately, it worked. But that transfusion didn't last forever. Even though the immune system seemed as if we were getting it under control, we still needed more blood. Tammi was still in critical condition.
This rare type of blood is noted to be more prevalent in Dalmatians and Dobermans. We contacted members of the local community and the local fire department and tested Dobermans and Dalmatians against Tammi Terrell's blood. Fortunately, the first 2 Dobermans that we contacted were compatible matches. With continued supportive care, immune medication, and compatible blood transfusions, Tammi Terrell continued to improve. However, we quickly noticed that she developed signs of severe infection.
The source of the infection seemed to be confined to her urinary tract, but she felt ill and something didn't feel right. The next day, we came to realize that she had developed an infection in her blood that had spread to her liver. And now we had no choice but to stop her immunosuppressive medications with the hope that she would not turn her immune system back on and destroy her red blood cells and platelets. And fortunately, because we removed her spleen, that was not the case. We were able to remove her drugs, we were able to treat her infection, and we were able to make her well again. Today, Tammi Terrell is here with us, not because of myself or Dr. Dienza or the rest of the amazing staff at the Schwartzman Animal Medical Center, but because of Bobby Milnick and Tammi Terrell herself and all the other people that came together to donate blood and work together, I would like to present the 2024 Living Legends Award to Tammi Terrell.